please join me in welcoming Dr. Alexander Angelov. Dr. Alexander Angelov, MD, is a distinguished surgeon specializing in urology. He obtained his medical education from one of the most prestigious medical schools in St. Petersburg, Russia. Medical schools in St. Petersburg, and he is founder of TrueHealingMD. From his early days practicing yoga to his pioneering work in urological surgery and acupuncture, Dr. Angelov's journey has been fueled by a profound desire to empower patients towards a future of holistic medicine. So please join me in giving a warm welcome to Dr. Alexander Angelov with his presentation, Artificial Intelligence and the Medicine of the Future. Please, Dr. Angelov.
One of my teachers is Rambam, and he wrote that about 80% of how to live without problems. And he said when you start healing, before you start healing, you should make a person laugh. So I will start with an anecdote. A patient comes to a psychiatrist and says, I am a god. And the doctor says, hold on. Let's start from the beginning. The patient says, well, in the beginning there was nothing. Then I created the sky and the earth. So we will start from the very beginning. We will start with what is an intellect in the future and what is an AI, artificial intelligence. So I'm very glad that a lot of topics were raised around AI, around artificial intelligence. So I'm right in it. So we have, like Elliot said, we have delusions that we understand something in this life, in this world, but in reality it's unclear how the artificial intelligence, how it relates to the medicine of the future, and what is the medicine of the future. What's good about artificial intelligence is it can quickly diagnose a person. For instance, if you have an EKG, it's hard for a doctor to make a decision. But if you have artificial intelligence, very quickly it can calculate because it's math. Same with computer topographics, MRI. Basically, when calculations come in, artificial intelligence can do a lot more than a regular person. And here there is a little problem. Today we have consultants like Dr. Google. It gives us answers for everything. We have supercomputer Watson that can calculate everything and much quicker than a human brain can do. We have resources that we can use with artificial intelligence, regardless of who musicians don't like the artificial intelligence because they're losing their profession. But in medicine, if you use it correctly, it can be very good. For example, I have a friend who is a doctor. He uses robots in his surgeries. He invited me one time, and I I saw what he does. He was doing a hip replacement. He was exchanging a hip. How is it done? First, you make photos, X-rays. Then, artificial intelligence programs programs the human in his wholeness, not just the hip. And the artificial intelligence checks what brands supply what components so that the surgery goes better for the human. So the artificial intelligence does the research and brings what's needed. I spent about an hour and a half with this doctor. He had joysticks that he was using robots to control robots during the surgery, all in the computer. All of a sudden, in the middle of the surgery, he said, "Oops, what's happening? Something went wrong." He was able to disassemble everything back to the moment when something went wrong and reprogrammed for everything to go right. That was the artificial intelligence that was helping to avoid mistakes. At the end, when I saw him in, outside out of the surgery, outside the surgery room, he was holding the joysticks just in case something goes wrong. He could intervene and correct. So the artificial intelligence, if used correctly, can eliminate a lot of mistakes. And this is one of the privileges when today a robot can perform a surgery better than a human. So everything has its place. Another aspect is we can 3D print human organs. Today, science came to such a level where we can easily replace organs unrelated to the fact of what we have outside conditions. And without processing this information, it would have been impossible. So we're progressing, we're moving forward, but we come to the main answer. Why do we need medicine today? And what is the medicine of the future? We're poisoning our surroundings with the toxins. We eat what we want. And what do we want? We want to be better. Our desire to receive doesn't stop at what it has. I can eat right now what humans 200-300 years ago could not eat. It was practically impossible. What did they eat before? Simple foods. Whatever I could get, I could eat. And now we need more pleasure. We're advancing, progressing. Our desire to receive grows, and we do things that we don't even understand because we are not in connection with our body. We're not connected to what the body needs and what it doesn't need. In 2008, there was a crash. All the businesses went under. The only business that was still functioning was stores for pets, pet stores. And they were growing. Why? Because we love our pets. We give them the best food. We do whatever it takes to bring them good. But we don't pay attention to ourselves. If we relate it to our body uh, and what our body needs or doesn't need, the same way we relate to pets, we would be very happy. We'd live a happy life. But today we think that we're going to continue enjoying ourselves, pleasuring ourselves, but the medicine will save us. Everything's going to be fine. Don't pay attention to what you do. Why? Because some robot in the future will bring you a red pill or something and will change everything in your life. And we'll continue receiving pleasures from what is bad for our body, but we will continue moving forward. Is that so or no? Nah, it's not like that. So, what is the medicine of the future, and where's the artificial intelligence in the medicine of the future? If we're constantly in harmony with nature, this harmony with this our environment, and we have inanimate, animate, and nature, and then that's our animalistic part. But we have to consume what our organism needs. But on the other hand, we have our human relationships, and in these human relations, we also have a lot of good, a lot of power. Depending on today, people already talked about it. Depending on if we are in harmony with each other, in positive feelings, if we want happiness for other people and other people want happiness for us, then we create some field. We don't know what to call it, but it's a field that gives us movement forward without diseases. So what happens? How AI can affect a person? Very simple. The AI should help a person to be in harmony in our society. You can eat normal food, you can have a great house and everything else, but if you don't have a good relations with society, then you create problems. So that means we should pay attention to what relationship we have with people surrounding us. Are we jealous of them? Do we want to harm them? Do we want to gain something at their expense, or the opposite? Like in any family, we want for everyone else to be good, to be happy, and it could be. And artificial intelligence is actually a quite interesting thing. It's a program. It's self-taught. I remember in 1998 we created a startup. We created a company that was supposed to compete with another company. I was a medical director of that company. I had to arrange everything and create diagnosis and ask no more than 10 questions so that at the end you come to an answer to a person that receives what he needs. I had a goal, a task. Today we have thousands of diagnoses. But at the end, I came to a conclusion that there's really only 10. For instance, take a hair. It's hair. Eyebrow is also hair, but we call it different. Eyelashes also hair, but we call it differently. So we have a lot of things that we get confused. I used to like programming, and I took one of the first programs of artificial intelligence, and I took it and started to tinker with it. And the person who was responsible for that in the company, he said, "You don't need to do that. Just let me in your thoughts. Tell me how it's done, and I will program everything." So I understood back then that what I have, what I do, can be translated into an artificial intelligence. Very simple, because it's not just an algorithm. AI is self-taught. It teaches itself. It does certain things. Honestly, it was the first time I used AI is during this presentation to create this presentation, and it was very interesting. I was trying to find pictures of sick people, knowing what questions I was asking. It was asking family, good people that I need to give to the public. It wasn't just the algorithm or a program. It was looking, it was feeling you, and wants the people that are listening to you to receive what you want to give them. So today, if you allow to come to allow this into your mind, you come to two pills, blue and red. We can program the whole system of medicine in such a manner that money will rule everything, which is what's happening today. On the other hand, you can program to make people happy. Everything depends on who's giving the information about how the medicine of the future should be. And in accordance to that, we came to this situation when the doctors are burnt out. They burn out. They cannot deal with this program of AI that's present in medicine. I don't know how in other countries, but at least in the United States, in the last 9 months, I lost a lot of doctors that I trusted that were trying to help people, and they can't be in the system because the artificial intelligence, what it did with pharmaceutical industries, insurance industries, insurance companies, something that wasn't possible before. A lot of them retired. At 60, 65, they retired because they cannot work in the system with artificial intelligence. So AI by itself is nothing. AI is how we put in uh, positiveness, love, um, happiness, relations that give good positive outcome, or to make more money. 3 minutes with a patient, next. We're brought up in a system like it's a Jeopardy. We need to give a patient very quick answers and move on to the next patient. This is the artificial intelligence of today, but it can be changed to a completely different one. So, what can artificial intelligence do? We can create programs that will help a person to be happy, to be healthy. If the person throughout the day is not moving, you have to remind them, push them. You have to get up, move. If they don't eat the right food, you need to make them understand and move them towards the positive outcome. And in that, artificial intelligence is priceless because it learns itself who needs what, whether it's a radish or kale or whatever. So artificial intelligence of the future is how to keep a person healthy. The picture on the left is the only one that AI gave me in production of this presentation of an unhealthy, heavy person. The rest of the pictures were of positive, healthy people. So we have to come to a point where we care for people, for their health. We have medical industry today that receives a lot of money from the fact that people are sick. We just have to flip the accent, switch the accent, and make it so the artificial intelligence wants to make people healthy. When we're in harmony, we cannot be sick. This artificial intelligence has to bring us to being in full harmony with ourselves, with people surrounding us, and with nature. And that's the medicine of the future. If you have questions, I'd be happy to answer.
Wow, wonderful. Wonderful. Thank you so much for this wonderful presentation here. We all feel inspired. I can feel it. And so I'm sure there are some questions. I already see a raised hand here. So if you want to have the opportunity to ask Dr. Angelov about the presentation, you can raise your hand right here in the Zoom room. You go down to the lower bar, to reactions, to raise hand, and then you will be seen on the screen. And we also will take questions, maybe from written questions, YouTube channel or Zoom. But let's proceed here. We have a question from Dr. Pines. Please go ahead.
Yeah, I don't want to be unfair if somebody else wants to ask first. I did ask last time, but okay, let me get this in quick. Professor Yasser Abu Mustafa, that was the name I forgot before, at Caltech in a talk last year discussed in his research how he developed an AI, and a very small and simple one by today's industrial research standards. Universities don't have that kind of money, as he complained, that could predict whether a cancer would grow, metastasize, I think perhaps, or stabilize or diminish from a photo. Physicians' evaluation from this proved to be about 50-50, just a random guess, but the AI proved correct in 90% of the cases. Do you see such an ability expanding to recognize cancers, as it were, in human relationships, to help identify the most serious problems in human connection, to help us develop that superorganism more quickly?
Thank you very much. I'll probably answer in English, and it will be easy for me. We are on different paradigm. We want to find disease in the early stages, and then what? Instead of finding disease in the early stages, we have to lead for preventative measures that this event will not occur. And that's a huge paradigm shift. So to find cancer in the early stages, what do we have? We have chemotherapy, we have radiation therapy, we have palliative therapy, and then what? We start the war against cancer about 70, 80 years ago between the United States and Russia, Soviet Union. We want to win the cancer, and where we are right now, we can put you in a trial, meaning that we don't have answer anymore. We put you in a trial. And at the end of everything, 90 versus 10%, it's still 50-50, yes or no. So artificial intelligence, and I know that one of the company get to me to support them, they can find cancer in the early stages. It's not the answer for me. The answer is how you prevent it.
Thank you. Thank you so much. We have lots of questions. Let's see, please, if you ask a question, be precise, and let's give us the chance here to have as many questions as possible. Please, Arturion, go ahead.
Can you hear me? Okay. I have a question. Thank you for the presentation. Very good for us. I want to know how can you use this technology grow up in our mindful life or inner life, because we know all of disaster come to our relationship. How do you use AI, this relationship, good for us? Thank you.
So I think the question was not heard in the main room. So what I hear here as a question is, how can we use artificial intelligence for our relationships? Is that what I heard as a question? So how would you see that? How can we use that or not?
Yes, we can. Absolutely. Our relationship is very predictable. Is it for my sake or for the sake of the others? And if we can interpret it, if we can make it that anytime I think about myself at expense of other people, it will give me a reminder that you have to think about other people. And that will be very, very instrumental. And artificial intelligence in this way will be absolutely perfect.
Thank you. Thank you so much. So let's move and to Professor Tanner, please.
Thank you. We all agree that we will not be sick if we are in harmony with nature, our relations, etc. But since the status of the mind and soul and feelings and thoughts of a person is in a diversity and a variety, how can we apply this to AI in the level of or in the consciousness of perception and empathy?
Great question. Thank you very much. Usually in my office, I have two steps. Step number one, resuscitation. If patient has a problem, I have to deal with this problem. But that's step number one. And it doesn't end there. Then I have to teach person how to live life in harmony. So basically, if you translate from Latin, doctor is the teacher. So we have to become teachers for the other people of how to live harmonious life.
Excellent. Thank you. So let's hear now Professor Notkin, please.
Спасибо, Александр, за прекрасный доклад.
Thank you. The question is close to what was asked. How does our system of integral education can help artificial intelligence facilitate health in people? How do we implement AI in integral society so it's helping the health of the people? I'll answer in Russian. What we can give in integral education to the AI, that's what artificial intelligence will bring to the world. We have to come to the state where we have something to say and how, and to do it on a level of heart to heart, so that the person doesn't simply understand, but also feels what we're saying. And then you can transfer it to the artificial intelligence and it can do its thing. But without us putting information into the AI, nothing's going to happen. And how we relate to one another without that experience, we cannot receive information. So our goal is to come to the state, love your friend as yourself, and give that to humanity.
Wonderful. Thank you. And we have one more question here. Please, Ernest, go ahead.
Thank you very much. Can you hear me? Hi. Thank you, first of all, for this amazing presentations. And really, I would like to ask a very brief question. I heard from you actually relationship for the humanity. We love your friend as yourself. I hear like a balance, equivalent like a balance with nature. And I hear the interesting part was the desire to receive. How you're able actually to include or integrate the desire to receive in all these parameters that you went through this beautiful presentation. I'll continue actually the question of Professor Lally also. Thank you so much.
Thank you, Ernst. You have kids, right? So how do you receive pleasure when you do something with your kids? They succeed. They get better. If you play chess with your child, you don't want to win just to make this child down, to put this child down. You want your child to achieve the level when the child will win and you'll have pleasure from it. What a beautiful thing.
Absolutely. Wonderful. Thank you so much again for this insightful presentation and your answers, inviting us into such a deep reflection. Thank you.